I wanted to get things fixed, and I actually could feel the face pull working every week.
Hmm.
I would have continued that treatment for 2 years, and I would have a perfect mouth right now. But because of the life situation, I couldn't, but I could feel it working. And that migraine is probably tied to poor sleep because it happened right
Mhm.
after I woke up, and my neck was probably in a bad position. I was mouth breathing exclusively and suffocating essentially without realizing it. Then I saw a chiropractor, and he gave me some adjustments and some treatment, and noticed that maybe I might have some mouth development issues or a tongue tie or some different things that I should go look at. So then he referred me to.
Welcome to the More Than Teeth podcast, where true health transformation begins in the mouth. Join your hosts, Dr. Michael Bennett and Kathy Bennett, as they explore the hidden connection between your mouth and your overall health. From sleep and airway disorders to nutrition and systemic disease, they're on a mission to help patients and healthcare professionals see oral health as the gateway to total well-being. So, let's get started.
Welcome back, everyone, to another episode of the More Than Teeth podcast, where we're talking about airway sleep and how it impacts everything, your health and your family's future. So today's episode is going to be different. And honestly, I'm really excited that this conversation is going to happen. I've invited a patient of mine, Eric Eberly, he's also become a friend as well, to come on it and share his journey. Eric's excitement, his knowledge is very unique and I think going to be very helpful and resonate with a lot of people. So he started his journey with treatment at our office. Actually, even before that, he developed, he was on a pathway for airway development, but he came and we started some therapy there to develop his airway, to treat his sleep disorder breathing and underdevelopment of his structures of his jaws. But life interrupted that process. And instead of stopping, this is the cool part, he jumped in, he took ownership in a way that I think is unique and should be very inspiring to a lot of people. And although challenging, very rewarding in its long-term impact on himself and his family. And so he's experienced lifestyle changes, breathing, movement, cold exposure. Utah Lake, it's the best ever for cold exposure.
Great place.
Yeah, great place. And also applied what he's learned to his kids. So it's not just about the treatment that I provided him. It's more importantly what he does at home, because that is literally the long-term strategy to maintain stability and airway function. So Eric, glad to have you on.
Yeah, thank you, Dr. Bennett. Glad to be here. Appreciate the opportunity.
Yeah, this is great. So first off, would you give us an idea sort of what life was like before treatment? What was your normal in terms of, or your experience with your energy and your sleep and your weight, your overall health? Tell us about that.
Yeah. I actually started with sleep apnea when I was 25. I was about 280 pounds and I was falling asleep at my desk. That's when I was diagnosed. And then I met Dr. Bennett probably about 32, 33. So I went 7, 8 years with a typical machine over my face that wasn't titrated for me. And I survived enough to basically survive. And then I saw a chiropractor, and he gave me some adjustments and some treatment, and noticed that maybe I might have some mouth development issues or a tongue tie or some different things that I should go look at. So then he referred me to Dr. Bennett. By the time I saw Dr. Bennett, I had lost all the weight, but still had sleep apnea. I was still pushing 60 events an hour, and I had to go to do sleep studies to prove all this. So I am down to about 210, 205 or so, and I still have the symptoms, but they've gotten a lot better because of the treatment that Dr. Bennett put me on. So when I first saw him, it was 2023. He put me onto the Replenish water bottle, which helps strengthen the tongue and the throat. So that will help open up everything to just begin. So as far as energy levels go, really overweight, type 2 diabetic. When you ask energy levels, it's hard to say that because I was drinking energy drinks. So I didn't have energy.
Yep.
So I was in a lifestyle of drinking energy drinks 2 to 3 a day, every day for about 8 years. And then I got a migraine. Yeah, self-medication, exactly. And then I got a migraine that set me on a path to basically find you.
Mm-hmm.
And that migraine is probably tied to poor sleep because it happened right after I woke up, and my neck was probably in a bad position. I was mouth breathing exclusively and suffocating essentially without realizing it. And I was after I already knew I had sleep apnea. I just didn't realize how bad it was and how much I needed to switch breathing through my nose. So that's where the treatment came in.
So how did you know that something was off? Like, you knew you were mouth breathing, but at what point did you finally go, okay, there's a connection with mouth breathing and the way I'm feeling, the migraines, et cetera?
I think the biggest thing, as funny as it sounds, is I just did this. I just took a deep breath through my nose and I just felt my insides relax and just something
Okay.
clicked. The stress turned down. And that's when the nasal breathing became extremely important. I had to just change everything about my lifestyle to breathe through my nose.
And then you had that experience where you're living your life on caffeine, essentially,
Mm-hmm.
and then you get your migraine. And that happened once, or was that multiple times you were experiencing
I got
that?
2 of those. Yeah. So I got 2 of those migraines. I don't know how to classify that migraine. I just know I couldn't do anything but wince in pain. But I was dealing with the chronic headaches every day. So I needed to come up with a better solution as well.
Hmm.
And so the headaches is what breathing through my nose actually helped reset quite a bit.
Okay.
And then the caffeine obviously wasn't helping either. It was
Who was the
basically killing me.
Yeah, no doubt. Who is the chiropractor that you saw?
So the chiropractor, his name is Ryan Clark. He's actually in Pleasant
Yes.
Grove. Yep.
Yes. Okay. Yeah. Brian went well. Okay. Great guy. Okay. So you had the migraines, you met with him. He said, go to Bennett. And then you came in. And what was your experience when we started doing? Okay. So we diagnosed you with an underdeveloped maxilla, essentially. Very much underdeveloped maxilla, actually normal mandible. Underdeveloped maxilla. And for our listeners, the maxilla is the central bone within the face and the upper airway because it's connected to all the other bones, all other 9 bones. And so the maxilla is the floor of the nose, and also it's sort of the wall of the throat airway. And when it's small, the airway is actually small. So that was the rationale of starting treatment. What could we do to expand the maxilla? Literature supports that you expand the maxilla, you improve breathing function. And so we engaged in that. And so what was your experience being an adult wearing something that's glued in to the roof of your mouth and going through expansion and the reverse pole headgear? You sent me a photo of that. So thank you. I appreciate that.
You know, when you deal with those challenges, your body starts to just get really desperate for answers. And I was told by an ENT to get surgery on my nose. And so also to answer your previous question, when I would exercise and bike, I would be out of breath no matter what I did. So I knew my breathing needed to be addressed. So that's where I came with the breathing as well. But when you started the treatment, it was about the treatment starting, right?
Yeah.
It wasn't that bad because I wanted to get things fixed, and I actually could feel the face pull working every week. I would have continued that treatment for 2 years and I would have a perfect mouth right now. But because of the life situation, I couldn't, but I could feel it working. I didn't mind. I got used. So you'll have to show the picture so people believe it. I would wear a face pull mask on my face with rubber bands on my mouth, taping my mouth shut with a nasal CPAP for 6 months straight. And it sounds miserable, but it really just became okay. Exactly. So when you're that tired, when you're in that much pain, that much suffering, you're desperate. And so I ended up learning how to sleep like that. And I loved it because I could feel the expansion happening and I could feel that my tongue wanted to move and everything just opened up. It's like a runner having tight hips and you just helped release them.
Yes. So I just shared the screen. Can you see?
Yeah, I can see it.
Okay. Yeah, there you go with your CPAP on underneath and face full mask. And your eyes you're looking at us like, I'm tired.
Yeah. Yep.
Okay. So you figured out a system. Your mouth is even taped.
Yeah. I can't sleep unless I tape my mouth. I wake myself up because I'm so used to nasal breathing to calm myself down and to sleep that now if I don't tape my mouth, I can't sleep. I love it.
I love that. Okay. Well, that's great. So life hit, you had to stop. You would have kept going had it not happened. So did things regress after you stopped?
So I actually wore my retainer for a little bit. I don't know if they regressed, mostly because at the same time I stopped treatment is when the tongue tie was cut by you. And I took his homework, so to speak, very seriously. And I stretched it for 2 hours every day for 2 months, which I think gave me a really good, strong tongue with proper flexibility, but not too much. So that made a huge difference. So I think that probably prevented the regress, as well as maybe I backed off the retainer after a couple months because I was worried the retainer was preventing growth. So I ended up backing off after a few months, and I don't think I had much regress.
Okay, good. Can I put you on the spot and have us show your tongue suction hold? Oh yeah, look at that. So our goal is 80% of your maximum opening with that tongue still suction cupped up there, and you're there. Yeah, that looks really
Does that
good.
look good? I
Yeah,
don't know. I just do it.
That looks really good. All right. So I wanted to show this again. Let's see. Oh, we're in the share screen. There it is. It's on the bottom now. Okay. So let's go back here and show. Here's a couple of pictures you sent me.
Which
your current.
the one on the left also shows you how well you guys can whiten teeth. So I just wanted to point that out as well.
Yeah.
I hadn't been to the dentist in probably 10 years, 15 years on that picture on the left. And so, yeah, you can see it's actually shocking. I used to be able to almost put my finger between my front and bottom, my top and bottom teeth when I would bite down. Yeah.
Yeah. Well, I dug out a before picture of your mouth before, and then where you're at currently. That's the one you sent me today.
Uh-huh.
And there's definitely, you can see more of your front teeth. They're less hidden behind.
Yeah, I pulled it up.
Yeah,
because that's biting down on my molars. On the one on the right.
Yep. And the one on the left, you're also biting down in your molars. It's just you're more in it since you bite. Look at that.
I actually didn't realize how much that's moved. Holy cow.
So then here's that same picture cropped out. Now I went in and I pulled your lower jaw pictures that are current, and then when you finish treatment. So actually the one on the right is the one when you started. The one on the left is the one that when we ended. We didn't do any expansion on your lower, but your upper. This is the one that you can see more width. With the on the left before, the right after. And that's was, how long did we go? Just a few months or so, it seemed like?
It's about 4 or 5 months solid.
4 or 5 months.
January to June-ish, yeah.
Yeah. And so there are some other pictures. And when you look at the reference point of just looking at how much tooth in the front incisors that you can see before there's less and after there's more, and you can see more of the back teeth overlapping on the lower teeth in the back area. So you think about which one has more space for a tongue or airway, and of course the larger maxilla. So good changes. Of course, I don't have your current situation. But
I was going to say we might need to get a new one. We might need this after a couple of years.
Yeah, we'll definitely have to do that. All right, so let's go back to let's see. So tell us, okay, now once you finished with your treatment with me, you set out on this journey. And to walk us through what that looked like. What was the first thing you started doing after you finished?
So the first thing was, the mouth taping was already like groundwork. So that was happening all the time. So the myofunctional therapy was the first thing I did consistently. And that I think kept the structure in place. And then what I continued to do, which I'd already been doing, was the Replenish water bottle and the mouth taping at night. And then one thing I also did at the same time, and this is tied to the Replenish water bottle, and this might surprise some people, but I also took up the Didgeridoo, which is a wind instrument from Australia that strengthens the same muscles that cause sleep apnea issues.
Okay.
So
Eric,
that was a big one.
You've got to just show us what that sounds like.
So it's
Can't hear anything. Okay. I've heard little bits of it. It's coming in now, but yeah. Okay.
Hang on. Give me just a second. Let me switch my mic and then we can do some editing here, but
okay.
My mic is it's meant for voice, and I think it's having a hard time picking up ambient noise. I did that on purpose.
Gotcha.
So, okay, so here's the webcam. Still nothing?
Nothing.
All right.
I can hear just the very beginning of it, and then it cuts it out. So no worries.
I'll text you.
Sounds good. Well, yeah, thanks for showing me. So is that a travel size one that comes apart?
This is actually not a travel. This is a 4-foot bamboo one, but I do have a travel one that's about this big.
Okay.
Yeah.
Wow. And is the whole family playing it now?
Trying to get them playing it more. Yeah. They can't get drones like me, but it's a lot of fun because once again, it also relaxes you. Because what you're doing is slow inhale, long exhale.
Wow. Right? Do you take a breathing right there?
That's exactly it. It's a shorter inhale. Yep.
I love that. Okay. What's next? What else did you do?
So we got the mouth taping. Now, the other thing with the children, because obviously the children, it's hard to keep them disciplined with things. The funny thing about the children is we picked up a book called GoPEX, which talks about moving everything forward and not using braces to restrict. And one of the things they teach in it is actually just sitting and chewing your food. I know that's crazy, but you sit and you chew your food. And so what we would do is we'd have our kids sit with proper posture, right? Knees on the ground or feet on the ground, back up straight. We would put a timer on for 5 minutes. They would take a bite 20 to 30 times and then swallow without moving their face muscles.
Wow.
You do that for a couple months.
Wow, that's fantastic.
And
better
there's actually,
digestion. There's so many good benefits of doing that. So
yeah, there's also, I have to probably send this to you. There is a program that you can follow. It's like a 30-day challenge, so to speak. And you do it for 30 days consistently to build the habit of consistently doing it more. So we did that 5 minutes every meal for a couple months to get that habit in. And then there were some other exercises where they would smile. We actually have the Replenish bottles for our kids. So these make a big difference because our two oldest kids at 10 and 11 were diagnosed with sleep apnea.
Okay.
So I knew we had to continue treatment. So taping their mouth shut, that was a huge thing. So the taping the mouth shut, drinking from the Replenish water bottle, focusing on chewing and not talking while you eat, playing the didgeridoo, doing the myofunctional therapy, making that mind to body connection that when you swallow, your tongue expands. I know it's weird, but I just think about it consciously. So I'm constantly putting pressure in my mouth so that over years I can make the progress I need to.
And there's a lot of controversy out there that some say that you can't make changes to the adult skeleton. And so what would you say to that?
I think the body adapts to change. That's what I would say. I think it adapts to whatever it's put into. My mouth obviously adapted. It was forced with metal. So that is forced. But then I think, and we'll have to look at the new scans, but I believe I've had proper expansion naturally with only a tongue. And so if we can see that expansion, which we saw, it kind of disproves that the maxilla can't move. Tongue's a powerful muscle. There's a lot of pressure in that mouth when you swallow.
Yes. Yeah, that's so true. And it's the original orthodontist and the only permanent orthodontist. Okay, cool. So you got into also some more exercising, and you talked about running with shoes that are barefoot shoes, things, and cold. Tell us a little bit more about that.
Yeah. So going into like the whole health journey, a lot of people will look at food and water, and that's great. But I kind of went one more step and went to breathing and then went back into the health world. So I focused on the breathing, and then I wanted to get better at exercising. Like I mentioned earlier, I had breathing issues while biking. Now I don't have as many issues, and that had a lot to do with slowing down running and just kind of being more with my body. So what I did is I would wear shoes that don't have a lot of restriction on my feet so that when I run, my feet just do what they want to do. Just like my tongue's now released, it can now stretch. Other shoes that I found would restrict me from running, or I had weird running form, and it just didn't feel good. I would try to sprint and my body was tight. But when I put the barefoot shoes on, it was like being a kid again. Your body just takes over and it just opens everything up. So last year, I couldn't move my pinky toes. I can wiggle all 5 of my toes now, just from changing to that barefoot shoe and opening up all the muscles and the tendons and strengthening all that.
Wow. So how many energy drinks do you drink a day now compared to what you used to?
0 caffeine.
0. Wow. And you have
caffeine.
energy in your eye? Yeah. Give us an explanation how your quality of life has changed.
Yeah, thank you for bringing that. I should have also prefaced as well that I was also on different types of medication that helps when you're overweight and have those health issues. So you've got a lot of compounding effects there. So off all the medication, drinking electrolytes, drinking things that are better for my body, just eating a healthier diet, but things that I have to chew and not just mash. What was the other question?
Yeah, just mainly what quality of life things.
Yeah. So back then it was just anger and frustration. Quality of life is almost like I can be happy again. I can feel the emotions of socializing with people and not feeling tied to something. Because when you go to work and you have to go to the gas station, it wears on you. And so I like that freedom. So the quality of life, I mean, it's night and day different. I feel like spending time with my kids, spending time outside, I have more energy to listen to people, and I have to worry less about supplementing with something to get that same energy and same benefit of having a good retention of memory, all those different things. Because when you have poor sleep, everything falls apart. So
how's that translate? Oh, sorry, go ahead.
No, I was just going to say, in fact, to give you another idea, a year ago, I did something I've never done. I actually learned to sing in German and played the piano.
Wow.
So I learned a new language. So it gave me an opportunity to just let my mind learn and expand and not just be so restricted with the pain and the suffering.
That's a beautiful thought. That was one of the things I was just going to ask you. What did that translate into with all that newfound energy and strength?
Lots of new skills.
Wow. So as a provider, as a husband, father, and all those roles that you have, what is this newfound energy translated into? What are you looking at in terms of pursuing your goals, your ability to achieve success in those roles?
Yeah, I think it gives me the opportunity to actually consider doing those goals now. My kids They say hi to me more. They hug me with 2 hands instead of 1, like a side hug. There's just a little more love because I have more time and attention to spend with them where I'm not suffering. When you're struggling with those issues, you're just so distracted. But once you start to slow things down and let your body just do what it needs to do naturally, then you have the energy to do what you need to do. So we went flying a kite on my birthday. I haven't flown a kite in years. It was so fun.
Yeah.
You know, you go on adventures, you just go do things, and you're not sitting there thinking, oh, I need caffeine because I haven't had it in 4 hours.
Yeah.
And I need it because I'm so tired because I can't sleep. So you're fixing so many problems that have plagued you. It's almost hard to put in words.
I love
It's
that.
a completely different person.
Share with us sort of your knowledge search. What books that you found especially helpful? And
Yeah, so there's obviously a lot of information out there. The internet, it can be tricky. A couple places that I went to. So one book that I picked up that we worked on with our kids is called GoPex. And this is from someone that practices the 4 Odontics things. And they have just different programs and things in here. I don't know if I should show it, but you can show you the cover.
Yeah.
But there's a program in there. It's with Sandra Kahn and Simon Wong. And they put pictures together. And this is geared for kids. It goes over so much stuff, so many good things.
Yeah.
And then you've got a book on playing the didgeridoo and how to play and how it actually fixes sleep apnea. It shows you how to strengthen all of the muscles and everything, which is really cool.
Nice.
So just sleeping, that's the kids. And then I'll give you a quick shot of this because it's quite a bit. This is my library. But these are 4 other books that I've looked through and studied and applied to my life or discussed with people about different life experiences. And what's cool about these books is most of what I've read, I've lived through, which is why I can speak so confidently about these changes.
Can you tell us the names of those books? Kind of just barely saw those
Absolutely.
titles.
So we've got The Oxygen Advantage by Patrick McCohen. And then another one by him is The Breathing Cure. So these are both on Buteyko breathing, as well as how to help in stressful situations, all sorts of things, how to improve athletic performance through breathing, things like that.
Okay.
And then you've got a book called Jaws that's written by a professor from Stanford named Sandra Kahn. And she talks all about her experience of changing her kids' lives with going with the more natural route. And she talks about the hidden epidemic, which would be the sleep apnea in kids, I believe. So that's what we experience with my children. And it's scary to think that your 10-year-old is unhealthy sleeping. It shouldn't be a thing, but it is. So this book dives into the warnings and the issues that could be caused without addressing childhood sleep apnea.
Okay.
And the fact that it's a pandemic that we need to know more about, which is what you're obviously opening the world to. So I love it.
Yeah. Oh, that's fantastic. Thank you for that. So now that we could spend a couple hours on this, honestly. This is so good. But as you think about people listening to this, they're going to be dentists and the public and anybody interested in airway sleep. So what do you think people are getting wrong about airway health as they kind of look at this and consider what we've talked about? What are the fallacies out there? What are they getting wrong?
I think one could be, why don't I breathe normal? Why can't I just close my mouth and go to sleep? Which goes into the whole society changes, all the societal changes. It's blinking. It's blinking. It's subconscious. Why would you think about something? A lot of times in the health world, you go with your water and your food because those you have to go get, but your breathing, you don't. So I think you just kind of forget about it. Once you read about the power of breathing and how important that builds everything out, then you realize the water and the food don't matter until you breathe right. So I think it's so important to have an open mind, to not shut your mind off to saying, oh, I already know. Because I just learned today about a benefit that someone had with braces that I didn't think could happen because of their experience, right? So there's so much information, there's so much learning that we can be doing. The advice I'd give is just read, study, talk with friends, talk with people, have real world conversations and experiences about your personal life struggles with these issues and work on it together.
Yeah, because how long can you breathe or can you live without breathing compared to live without water?
Yeah.
It's pretty significant in either one. It's important, but breathing, you only last a few minutes. Yeah. So thanks. That's a great point. So if somebody's listening, they're saying, okay, what's my next step? What should I do tomorrow after learning about this? What would you say?
I think the easiest first step is the mouth tape. You go to Amazon, you get some simple mouth tape, whatever. There's lots of options out there. I don't want to specify one or the other. You tape your mouth, and if it's hard for you, some of the books recommend doing that an hour before bed. But taping your mouth instantly changes your body's ability to breathe. However, it could be a bit of a change. So that might be tricky. So that's a pretty cheap and easy thing you could do right now. Even easier than that is to go out on a walk and don't breathe through your mouth at all. See how easy that is. That's where I started. So I have a really bad nose. I had to start by walking with my mouth taped shut with like one of these turbines in it to open it up. That's how I started until I could run with my mouth shut. So start simple. Tell yourself to breathe through your nose and just figure out a way to do it. Tape your mouth shut. If you really want to dive into it, look at some books and start finding out for yourself. Start realizing that these people have the same issues you did.
I love that. So where do you think if they're saying, okay, I can do those things, but at what point do you feel like there's a coming together of, okay, should I seek some professional help in developing my airway, addressing kind of understanding? When do you think that they should embark on that journey of getting professional care?
That's a good question. Actually, believe it or not, I went to seek help with airways like 9 years ago with someone else, and I just didn't feel the same experience that you had doing it. And so I just didn't go with that program. So it's hard. It's hard to commit to this. It's very hard to commit to it, but there's nothing better. I might have to come back to you on that. That's a tough one.
Yeah, that's a good one. And what I would interject is simply if a person's struggling with chronic pain, chronic energy fatigue issues, sleepiness, daytime issues, then those are serious. They can lead to serious medical conditions if they continue on. And so that's where I would suggest if someone is experiencing those types of things, that it literally could be part of the answer, getting that breathing function established, good sleep quality established, and then the body can start to heal itself. And a major theme in what you've described, Eric, is the fact that you really believe and have experienced that your body knows how to heal itself. And you've gone through this healing process. You're not drinking any energy drinks right now, and you've got tons of energy to learn the language, learn how to play an instrument, and do all kinds of wonderful things to be a better dad and all your other roles as well. And so that's the exciting part is when we can combine somebody with airway expertise and sleep expertise with a person's willingness to be diligent and apply these principles at home. Man, there's an amazing unleashing of healing that can occur more quickly when we combine that. The challenge on my side of this, being a professional that does airway, is finding people that get excited about it and then fall off the wagon of compliance. Like, I don't want to do my exercises. I don't want to follow up with my appointments or wear my device as recommended. And so then the outcomes can be compromised as a result of that. And so
it's not tricky.
Yeah, for sure. Well, very good. Well, thank you for coming on with this. This isn't about appliances or expanders that we talked about earlier today, but it's more about just somebody being an advocate for themselves, like Eric did for himself and his family. And really appreciate your giving us a lot of details about that. And I would just encourage anybody listening to consider how their overall health is. Do you feel tired? Are you on lots of medications? And have you been on those for years and years? Have you really looked at sleep, your sleep quality as a possible avenue for helping your body heal faster? I can't tell you how many patients I've worked with who, once they got sleeping better and eating right, they started to feel better, and they worked with their prescribers, and eventually they were reduced in their dosages until eventually they were all off of their medication. And it's just another testament about how the body starts to heal itself once we give it a good night's sleep and work on all those other important things like movement and a good exercise. So Eric, thanks again for coming on and sharing your story. Any parting words you want to share?
Just find a good reason to do it, to make the change. It's like you said, I think I was just suffering in enough pain where my body was like, okay, time to make a change. And I did. And I got addicted to how much progress I could make. It's like climbing a mountain or flying to the top. One's way more satisfying than the other.
Yeah.
So
awesome.
I would get after it.
Great finish. Thanks again.
Absolutely.